What are your thoughts about social anxiety? How would you advise to overcome the same? So I would start with Dr. Sandeep.
I was already mentioning about social anxiety in my presentation also, as you would have heard. Cognitive aspect, behavioral aspect, and medicinal aspect. I'll answer in these three aspects so that it will be more crisp and clear. Cognitive aspect meaning, cognition meaning the way we think, learning. Cognition is a word that is related to thinking, learning, memory. It is a cognitive skill. So the cognitive aspect meaning cognitive reframing. That means cognitive restructuring. So social anxiety, basically what is social anxiety? You are very anxious in social situations. You do not want to interact with others, or you are very anxious that you feel that you would be judged and all. So as I already mentioned, that fear of scrutiny is a very maladaptive cognitive thought pattern that will cause more anxiety. What will others think about me? Will I perform up to the mark? So if you can just be yourself, if you try to impress others that you know more than what you know, then you would be very much stressed out. Suppose actually if I sit here as a psychiatrist and pretend that I know everything in the under the sun and including the sun and above the sun, then I'd have to be very stressed out to act, that superior. But if I know that I know this much, and I may not know everything, but I know something, and I know something more than other people, but compared to some other people I may know something less. So like that, about my strengths and about my weaknesses, I need to be have a realistic awareness. So I need not act that I know everything, but I can be natural, and I need not worry about how others would think about me. But especially in some presentation or interview and all, we should work hard and prepare as much as we can, but leave the rest to the Almighty, as I always say, and be cool and be natural. So like that, reframing your thought pattern will help you to have better control of your symptoms. So that is a cognitive aspect. The behavioral aspect, so CBT is a popular what to say psychotherapy model, cognitive behavior therapy, that is CBT. So I was studying about the cognitive part. So there can be many modulations in the cognitive part. I was just telling about the crux of the social anxiety. Then the behavioral part, where we can rehearse. Even nowadays, actually, this when clients come to me about the social anxiety, in previous days, we used to say that go before the mirror and practice what you want to talk. Nowadays, we have the selfie video. This all everybody has got this selfie video, selfie photo is there, selfie video is also there, and just record. Sometimes actually the way you speak, the accent, and just suppose actually you need to give a talk for 5 minutes in your classroom, so or in your what to say workplace. So you make a selfie video of yourself. You need not even tell your parents or friends to record that. Even in the selfie video mode, you can just record, and you just say as if you imagine that you are in that stage or wherever, and you do that, and then you see whether your mannerisms and your accent, your modulation of sound, everything is all right, and just improve yourself. And if you're more comfortable, then you can have a real life performance in front of your parents or your close friends, who wouldn't judge you and criticize you, but rather appreciate and encourage you. And so increase that social circle. So first you in the selfie video, then in a social circle that would that is most supportive to you. Sometimes it will be the closest friends, so it can be your own spouse or children or parents or whatever. And sometimes it can be and then increase the circle gradually. Take every opportunity whenever you get a chance to speak in some social forum or wherever, you take the even actually to share something in a common platform. And sometimes actually it can be, start with probably one sentence only, but after that, sometimes you practice makes perfect. And like that, that is what we call graded exposure. That means there is some psychology type. This means that in a graded manner you are getting exposed to that anxiety provoking situation. So you can make even a list of anxiety provoking social situations, and you can put what we call as a SUD, subjective unit of distress. So what is the most distressing, or what is the most anxiety provoking situation, social situation? You can imagine probably you are facing 1,000 people, audience, or whatever. Or the least social anxiety provoking situation would be probably you are speaking to your spouse, or you are speaking to your family alone. So like that, you make a list, and in that in a graded manner, increase the social circle, and overcome gradually, and even some relaxation exercises, deep breathing exercises, some physical exercises. That is the behavioral aspects. All these things will help. And then the medicine aspect. If it is too much of a anxiety that is really making you dysfunctional, incapacitating anxiety and all, then actually a small dose of medicines and in a many good SSRIs and many good group of antidepressants and anxiolytics and all are there, which will help you to feel better, and that will help you to face that situations that, and after some time you may not need all that. After sometimes you can taper off all that and all. So that was what I was trying to say about the cognitive aspect, the behavioral aspect, and the medicinal aspect.